Good day everyone, we are the group of Axipis today. I am Andrea Lorraine G. Benedicto together with Miss Ella Rose Joy Santiago and Miss Hyra Faye Santiago, and we are here to present the nursing care plans for pancreatitis. So the first NCP is for acute pain related to inflammatory process of the pancreas. For the assessment, subjective, sobrang sakit ng itaas na bahagi ng tiyan ko, ngayon pati likod ko sumasakit na din, as stated by the client. Pain scale score of 10/10 according to the patient. Objective, facial grimace, irritable, tenderness of abdomen when touched, Callen signs, Gray Turner sign. Vital sign taken as follows. For the temperature, 36.9 degrees Celsius, respiratory rate 10 cycles per minute, pulse rate 102 beats per minute, and the blood pressure 120/90 millimeters per mercury. For the diagnosis, acute pain related to inflammatory process of the pancreas as evidenced by reports of pain scored 10/10 using pain scale, facial grimace, irritability, Callen signs, tenderness of abdomen, and Gray Turner sign. For the outcome identification, within 6 hours of intervention, the patient's subjective perception of discomfort decreases, and it is controlled within 24 hours as documented by pain scale, and non-verbal indicators such as grimacing and irritability are absent or diminished. For planning, short term, after 6 hours of nursing intervention, client will report a score of lower than 4 using a scale of 0 to 10, which indicates that pain is relieved or controlled. And long term, after 24 hours of nursing intervention, the client will be free from pain.
For the continuation of the report, I'm Hyra Faye Santiago, and here's the implementation. In independent nursing interventions, first, we must establish rapport to provide comfort and cooperation with the client. Next, monitor verbal reports of pain, noting specific location and intensity, using 0 to 10 scale. Note factors that aggravate and relieve pain. The rationale for that is, pain is often diffuse, severe, and unrelenting in acute or hemorrhagic pancreatitis. Severe pain is often the major symptom in patients with chronic pancreatitis. Isolated pain in the right upper quadrant reflects involvement of the head of the pancreas. Pain in the left upper quadrant suggests involvement of the pancreatic tail. Localized pain may indicate development of pseudocytes or abscesses. Third, maintain bed rest during acute attack. Provide quiet, restful environment as it decreases metabolic rate and GI stimulations and secretions, thereby reducing pancreatic activity. Fourth, promote position of comfort on one side with knees flexed, sitting up and leaning forward. It is done to reduce abdominal pressure and tension, providing some measure of comfort and pain relief. Note that supine position often increases pain. Fifth, provide alternative comfort measures such as back rub, encourage relaxation techniques using guided imagery, visualization, quiet diversional activities like watching or listening to TV and radio, because it promotes relaxation and enables patient to refocus attention that may enhance coping. Sixth, keep environment free of food odors as sensory stimulation can activate pancreatic enzymes which increases pain. 7. Maintain meticulous skincare, especially in presence of draining abdominal wall fistulas. It is done because pancreatic enzymes can digest the skin and tissues of the abdominal wall, creating a chemical burn. For the dependent nursing interventions, first, administer medications as prescribed by the physician, such as narcotic analgesics, sedatives, and antacids. Nurses must always remember that we cannot administer medicines without prescription. Second, administer analgesics in timely manner, smaller, meaning more frequent doses. Severe and prolonged pain can aggravate shock and is more difficult to relieve, requiring larger doses of medication, which can mask underlying problems and complications and may contribute to respiratory depression. Third, withhold food and fluid as indicated. It limits and reduces release of pancreatic enzymes and resultant pain. Fourth, maintain gastric suction when used as it prevents accumulation of gastric secretions, which can stimulate pancreatic enzyme activity. And last, prepare for surgical intervention if indicated. Surgical exploration may be required in presence of intractable pain and complications involving the biliary tract, such as pancreatic abscess or pseudocyst. Lastly, evaluation. For short term, after 6 hours of nursing intervention, client reported that pain has decreased from scale of 10 to 3, which indicates that pain is moderately relieved or controlled. For the long-term goal, after 24 hours of nursing intervention, the client is free from pain. Both goals were met. For the next NCP, we have here the NCP for ineffective breathing pattern related to severe pain and elevated diaphragm. Let's start with assessment. Subjective cues. Hinihingal ako at nahihirapan huminga dahil sa sobrang sakit ng itaas na bahagi ng tiyan ko, as stated by the client. And pain scale score of 10 out of 10 according to the patient. For the objective cues, abnormal rate, rhythm, and depth in breathing, dyspnea, nasal flaring, use of accessory muscles to breathe, and elevated diaphragm as seen on chest x-ray result. And vital signs are taken as follows: temperature 36.9 degrees Celsius, respiratory rate 10 cycles per minute, pulse rate 102 beats per minute, BP 129 mmHg, and oxygen saturation of 90%. And next, for the diagnosis, ineffective breathing pattern related to severe pain and elevated diaphragm as manifested by reports of pain scored 10 out of 10 using pain scale, abnormal rate, rhythm and depth in breathing, dyspnea, nasal flaring, and use of accessory muscles to breathe. For the next reporter, we have here Ella Rose Joy Santiago.
So for the outcome identification within 24 hours of nursing intervention, patient will have an effective breathing pattern as evidenced by respiratory rate of 12 to 20 breaths per minute with normal rate, depth and pattern hypnea, oxygen saturation greater than 92%, absence of nasal flaring, and no significant change in mental status, orientation to person, place and time. For the planning, short term, after 2 hours of nursing intervention, client will establish a normal respiratory rate as evidenced by respiratory rate of 12 to 20 breaths per minute with normal depth and pattern hypnea. For the long term, after 24 hours of nursing intervention, the client's breathing pattern will be effective as manifested by normal respiratory rate and SpO2 of 94% and higher. For the implementation, the independent assess and document the respiratory rate every 2 to 4 hours as indicated by the patient's condition, note pattern degree of excursion, and whether the patient uses accessories muscle of respiration, report significant deviation from baseline to the healthcare provider. Regular pattern decreased chest exertion and use of the accessories muscle of respiration occur with the impending respiratory compromise can occur with ARDS and respiratory failure, and may be a sign of inadequate and control or worsening pancreatitis. Assess for the changes in mental status, restlessness, agitation, and alteration in mentation. These are the early signs of hypoxia. Monitor pulse oximetry every 8 hours or as indicated. Report oxygen saturation like 2% or less. Monitor arterial blood gas result as are available. Report PaO2 less than 80 mm mercury. This will increase the values usually signals need for supplemental flaring oxygen. Elevate head of the bed 30 degrees or higher depending on the patient's comfortable level. Explain to the client and significant other that the patient is at risk or hypoxia. Instruct the patient in the method of split the abdomen. This information will help the patient to reduce pain or movement, coughing and deep breathing, which is turned into a respiratory effort. Dependent, administer oxygen as prescribed, monitor oxygen delivery system at regular intervals. Hypoxia is an early sign of impending respiratory failure and necessity of oxygen delivery. Administer analgesic at dose and frequency that relieves the patient the pain and associated impaired chest exertion. Reducing pain will enable to chest exertion for the better oxygenation. Encourage the activity as prescribed, promotes effective airway clearance. And for the evaluation, the short term, after 2 hours of nursing intervention, the client was able to establish a normal respiratory rate, as evidenced by the respiratory rate of 14 beats per minute, the normal depth and pattern eupnea. For the long term, after 24 hours of nursing intervention, the client's breathing pattern was effective as manifested by the respiratory rate of 16 and the SpO2 of 96%, and the goal was met. And here are references. Again, thank you so much for watching, and we are the group as